and that will track that you are here throughout the session. Before we move on to our revenue cycle panel, please don't forget to hop in, if you haven't already, to the auction site through the Crowd Compass app, and let's run those numbers up for the benefit of a more healing kitchen. Some great items. We'd love to see those numbers go up into the thousands. So we are going to move on to our revenue cycle panel, but before that, we have a special guest with a special announcement, and we're going to jump to her now.
Hey, all you cool cats and kittens at the Georgia and South Carolina HFMA. I've been told that you are finance revenue cycle employees at hospitals in Georgia and South Carolina. The CFO, the finance directors, the patient access and registration folks, all of you are so essential to hospitals. Oh, what would they do without you? Their financial success is so dependent on you, and you guys are what makes it possible to keep those doors open. So thank you so very much for all of the hard work that you do. And I have to tell you, given what hospitals are having to deal with right now, I appreciate every single one of you who are stepping into the breach between this pandemic and utter ruin. You guys are absolutely rocking it. Stay cool, cats. Mwah.
Thank you, Carol.
Wow.
Appreciate you joining us today. What a great surprise. We're going to jump over now to our Rev Cycle panel. So please welcome Bill Eichest, who is moderating for us now.
Thank you, Lawrence, and thank you, Carol. My goodness, that is a nice surprise. So, good afternoon, everybody, and welcome back. I hope you're enjoying the conference so far. It's just been terrific. I know the tickets for this particular session sold out in about 10 minutes. We've got a very esteemed list of panelists today. My name is Bill Eichest, and I am a past president of the Georgia chapter. I work for a company out of northern Minnesota called Nemadji. I'm based right here in Atlanta, Georgia. Nemadji's back-end eligibility detection solution combines an extensive knowledge of our staff and advanced logic to review patient accounts for cases of missing or previously unknown insurance or eligibility across Medicare, Medicaid, and commercial insurance. Nemadji also has developed a denial management solution called Resolve, which is a fully customizable solution to support and optimize the hospital's existing efforts on denials to ensure that you receive the reimbursement that you're entitled to. So we're happy to sponsor this session, and I'd like to introduce you to our speakers today. A reminder on the CPE that Lawrence mentioned, make sure that after you enter your name in for today's session that you also put CPE after your name. You'll be required to answer the polling questions that will be presented to you throughout this session, and we would ask that you respond appropriately to get your ANA and CPE credits. So our panelists today, let me introduce you first to Valerie Barkoff, but Valerie is going to be the moderator for today's call. Valerie is no stranger to Georgia HFMA. Valerie is a principal of the healthcare consulting practice with Wyndham Brannon. We've also got Rick Childs, who's the Vice President of Revenue Cycle Management at Floyd Medical Center. We've got Jason Driscoll with us. Jason is the Vice President of Revenue Cycle Jason is Vice President of Revenue Cycle for Lakeland Regional Health System. There we go. Is that better? We've also got Celeste Day. She is the Executive Director of Revenue Cycle Management at Grady Health System here in Atlanta, Georgia. And lastly, we have Mr. Chris Lofton, who's the Regional Business Office Director for Baptist Memorial. Chris is out of Jackson, Mississippi. So I would encourage all of you to go into the Crowd Compass app and look at the speaker bios to learn more about these wonderful panelists' experience and background. We're really delighted to have them today and appreciate all of them participating. And with that, I'm going to turn it over to Valerie.
All right. Thank you, Bill. I think Carol Baskin might be a hard act to follow, but if I know this group from having met with us, I think we're going to be able to, you know, at least put on a good show for them. Before we start with our questions, I kind of just wanted to lay the groundwork about everything that we've been through. I was lucky enough last year to moderate the Revenue Cycle Panel in person in Savannah, and what a difference a year makes. So here we are now remotely. Obviously, all of us have had to deal with COVID. Everybody had to rapidly deploy their staff home. Last week when we were prepping for this, hospitals were at the top of the news because of cyber attacks against us, because we are, you know, easy prey and have a lot of great information. We haven't been given any reprieve on regulations with price transparency and interoperability. And then we're just seeing a lot of innovation and technology with artificial intelligence, robotic process automation. So it's been a very, very busy year. So one of the questions I want to start with, and Celeste, I want to start with you, is like, what are some of the top challenges and priorities that your organization is facing right now?
So just as you mentioned, Valerie, and we talked about this, is I don't think that we're unique. I think that we're all dealing with capacity issues, and depending upon where you are. So we were on a diversion because of a flood we had in December. We are back online, and so that's great. However, with the increase of our COVID patients, we're still struggling with being able to serve the community, right? And so that challenge is our priority. Our priority is serving the community, addressing the revenue implications of not being able to provide elective services, surgeries that patients need and want. And so we're still dealing with that. That's probably our biggest challenge.
All right, I'm going to go across the top, and Chris, you're next in my line of sight. How about your organization?
You know, very similar to what Celeste indicated. We're, you know, our big thing right now is trying to get back up to our baseline as far as revenue, and we're pacing extraordinarily well. But you know, the financial impact of COVID-19, I think, affected all of us. And our main thing, outside of just protecting employees and our clinicians during this crisis, is making sure that we're getting back up to revenue. Luckily, in my state, in Mississippi, we're wide open as far as electives, and so we're able to do that. Same thing in Tennessee. So we're getting back to normal somewhat, but that's the main focus for the health system at this time.
All right, and you, Rick?
Well, we've got a couple things going on. One, you know, with COVID, and we'll probably hear that term several times this afternoon. You know, with employees that get exposed or actually have an infection, we've had some issues with keeping staff in place, especially on the clinical side. Outside of that, you know, denials continues to be a rough area. I think the payers find every avenue they can to deny a claim and see if you're going to discover it quickly or not. So, you know, we really focus on denials a lot here.
All right. And Jason, how about you guys?
Yeah, we have working on as far as a great deal of patient engagement, as far as the change with COVID, obviously has caused us to rethink as far as how we, you know, look at scheduling, how we look at registration, how we look at release of information, you know, all of those things throughout the entire rev cycle. You know, what is the new model that we need to go to? How do we look at it from an electronic standpoint and look at the technology that can assist us and get us to where we need to be? Yeah. That's really where we are. You know, obviously, everybody, like a lot of what everybody else has said as far as volumes and trying to return back just to a normal state as far as from a financial standpoint, all of those are the same as well. So.
All right, I want to take a deeper dive into one topic, but I'd love to see if we can't get the first polling question up because it's going to lead into it. So I think it's Max running it for us. If you can launch that first poll question. I'll give him a second. All right, well, I'm going to move right on. So I wanted to take a deeper dive into the impact that COVID had on revenue cycle operations. And, you know, I was at a client site when it was going on for us, and you know, it happened within a matter of like a week that everybody was on site and we had to send everybody home. So rapidly sending our teams home when COVID hit. Do you plan to bring your staff back when or if it ever returns to a state of normalcy? Are you going to continue with a remote workforce or a hybrid? I think people would be really interested to know what this panel plans on doing. So Chris, maybe we could start with you. What are your plans if and when we return to normalcy? What are you going to do with your staff?
We're going to do most likely a hybrid of, part remote, part in the office, or maybe even a rotation. I think during our preparation for this meeting today, we discussed that, and I made the comment that I think the business, the brick and mortar business office of the old days will be gone as a result of what we've been doing for the last 7 months. And I think that's not necessarily a bad thing. Health systems are going to be able to save overhead expenses if they do gradually shift to this and maybe utilize that space for clinical care. So I think ours will definitely be a hybrid. Others may have difficulties depending on leases that they might have, that they're, we're like my building, we're in a little bit of a lease right now. So it'll be a blend for a while, but I think long term, I could see us going, fully remote at some point.
Okay. Rick, you want to go next with what your team plans to do?
Sure. We will be a hybrid as well. We have a few roles that today we can't really do from home. So I've got a small group that comes in daily. Right now we're still, fully remote, but we will be a hybrid. We actually have reduced space. So the hybrid team will really, on Wednesdays, will be a shift day. So team A, if you will come and switch out on Wednesdays with team B. And that way management gets to see staff every week. So we think that will be one way to keep everybody really fully engaged with what's going on.
Yeah, I like that idea when you shared it with us, is that switching in the middle of the week. Jason, Celeste, what about you guys? What's the long-term plan right now, if you can have one?
Yeah, so I think, again, like others, ours will be hybrid because we found that there were some staff that did not want to work from home, right? So we have always had people here. I have been here for the most part and here every day. We do have a rotation currently that the managers seem to appreciate that. And so we will have a hybrid model, but we'll have to work out a lot of the details. So I've enjoyed listening to Chris and Rick's, some of their, some creative ideas around how to do that.
Jason, same with you?
Yeah, very similar as far as our coding staff, our CDI staff, and the coding as far as both ambulatory and hospital, as well as our business office are all off-site right now. Probably looking at, and that probably encompasses 250 FTEs. We're probably only looking at maybe less than 5 that are coming on site just to simply either handle opening mail, scanning some things, just doing some things like that. And we've got to figure out what those solutions are in the future, but that's probably the very limited number that will ever either return or are returning right now. Most everything else will be offsite permanently.
Yeah, I think that's what we're hearing too, is that pretty much everybody is enjoying the remote workforce. I know some people say, the results are still mixed, but most people have experienced an increase in productivity. Has your team, Jason, experienced an increase in productivity by being remote?
Absolutely. Not only our staff, the frontline staff that is in the business office seeing higher productivity, but our management staff seems to have more free time because they just didn't have the pop in, pop out type of onesie questions that were slowing them down. They've now retooled, they've refocused their efforts, and they're much more productive themselves as well. So.
I want to go ahead and see if Max can put the second poll question up as we dive into a little bit more detail about the risks. So when we had to rapidly send people home, it definitely creates a little bit of risk because we didn't have time to, pilot it and make sure that workstations were set up correctly. Rick, I think I'll start with you, with this remote and, future hybrid model. And we know that there's cybersecurity attacks and that we are low-hanging fruit at times. Do you have any concerns about your staff and protecting PHI and adhering to, protocols about phishing schemes? And what have you guys done to help protect Floyd?
You always have concerns when information may be out at home. So we're looking at processes to, we have a sign off that everyone has to do that's working remotely, that they are protecting and they are securing their data. But from an IT perspective, we use Floyd devices, and they're set up so like you can't print from home. If you're going to print something, it's going to print in the office. So it goes through. We've also locked down the ability when you're on one of the Floyd devices, you can only really be on our network. You can't access your personal email from that device. It locks you out of that. The FBI and Homeland Security, some of the stuff that they've come out with is that's how the ransomware and malware folks are trying to get into healthcare, is they're going through people's personal email addresses. So we've locked them out. Another piece that we're doing is backing up our systems on a regular basis, daily, every other day in some cases. And we put it in multiple locations. We have 2 off-site locations where a backup goes, as well as in the cloud. Then like in Revenue Cycle, we've got a couple vendors that help with workflow. We have backups on those systems. So if we were to lose the host system, we've got the ability to still get to accounts through some of our support systems, so we can keep working on accounts while they're bringing the system back.
Yeah, I know one of the things we had talked about during our prep session was workspaces, and that most everybody here, I believe, has policies that, says you have a secure workspace, that you're going to be protecting information. And in previous lives, we would maybe do pop-ins. Are there any concerns with any of the other panelists about just the workspace and making sure that, other people who are in the same living environment aren't having access to, confidential information? And what are you guys thinking about doing there?
Yeah, so I will jump in. I definitely have concerns about that. And I think it's because, initially we did have people sign an agreement. We had people prior to COVID, quite a number of people in the revenue cycle were working remote. But with COVID, it was a mad dash to get people home safe. And the reality is that I don't think it was a realistic expectation that people were going to be able to follow that policy to the letter, given, kind of the rush. So now I think as we reel back and we've given people time to get their spaces in kind of uniform, if you will, then I do think it's time for us to begin to figure out how we evaluate that and confirm it, and then make decisions about if they're not able to do that, how can we help them or talk about coming back in the office. I have real concerns about that. And so I do think it's something that, 8 months later, we need to now start to be a little more rigid, because I think we were all about just trying to be flexible because it was about safety. And now I think we need to do more.
Yeah, I agree. I mean, it would be one of the things, if I was still back at St. Joseph's, I'd probably be, having a little bit of loss of sleep, worrying if people were getting creative. I always say our staff will get their job done. It's the path of least resistance, but we may not like how they do it. So we just need to go behind them and double check. I want to lead into 2 things. So you guys all have remote workforce. I want to talk, I think maybe Chris, you had talked about it first in terms of if we're planning on having a hybrid model, and our staff are at home. And talk to me a little bit about what changes with recruiting. And then Celeste, I might come back to you to talk a little bit about, the issues with staff last week when we all lost our electricity. But Chris, maybe talk a little bit about what your plans are for recruiting now that we have a remote workforce.
Well, it's definitely been a challenge. I can tell you, especially now that we've got a few vacancies that we've been trying to recruit here, even locally. It seems like the market is kind of shy right now. Folks are scared of moving, to new companies during this crisis. But I think in long term, we're going to be looking more at a regional approach. At least that's what I've been discussing with my HR recruiting department, that we're going to be looking at outside of my normal recruiting area, which would be within 30 to 45 minutes or even an hour from here. In fact, we've recently recruited people that were over 100 miles away that would not be driving here, simply because we're doing a pilot on remote work for a long-term approach. So if anybody, I'm from Mississippi and we're part of Region 9. If you have anybody over in Georgia and South Carolina that's really good, let me know. We'll recruit them.
Yeah. Keep your hands off.
Well, it's funny. I actually do think this is an opportunity and risk that we all have to be prepared for, is that now that we're remote, we're realizing that we can onboard staff remotely, we can manage them remotely. So it's going to open up the playing field. So all of a sudden you are competing not just with the people within driving distance, you're competing with people in California or others. So, I think it's an opportunity for us to recruit high talent, but for those of us who maybe don't have as competitive salaries, or our work from home arrangements aren't as nice, we might be the ones that are at risk, and we really need to think about how this could potentially impact us in 12 months, 24 months, as people do get comfortable going between jobs. Celeste, when we were prepping last week, we were coming off of the heels of the Zeta coming through and knocking out power for several days for a lot of people. It came up because you were talking about people scurrying to come back on site. This changes how we have to think. We used to worry about our staff not being able to get to work if there was a snowstorm. Now we had a situation where we had several, I think it was 1 million people or more in Atlanta who were without power, and you didn't have places for them. Is this going to change how you think about contingency plans?
Definitely. So we've started those conversations because we all have business continuity plans for just what you described, but we have to think about how much capacity we have in the office. So the good problem to have is that I just had team members that said, I need to work, and, planned on coming in, but we largely sent people home with their devices. So every desk doesn't have a PC anymore.
Mm-hmm.
We haven't situated such that there's the social distancing, because we have such a small number of people here, they're easily social distanced. So yes, we really do we're working on that. And I encourage everybody to think through that, because it was a surprise, and who would have thought that? And so we got through it, but it was definitely a lesson learned that we have to have something prepared sooner rather than later for those instances.
Yeah, I think it was a nice eye-opening experience, is that right now we haven't downsized like physical locations, but we have to social distance. But in the future, I can see organizations having less physical space. And if we have an event like we did last week, where are we going to put all these people so we can keep working on it? I joked that it's like portfolio management. Maybe we need to diversify our employees in different regions so that if one region goes down, we have another region that stays up and running. I want to maybe with Rick and Jason, talk to me a little bit about the lessons you've learned in managing a remote workforce. How have your supervisors adapted and managers adapted? And, what are you guys doing that's unique to make your teams feel part of a team, even though they're working from home?
Yeah, I'll start. One thing to follow up with Celeste real quick. One of the things that we've done is we've shrunk that staff because we'll be in that hybrid model and people will share desks. We've opened up some areas that we're calling hoteling spaces. So if you have people that need to come in, a power outage, or they just need to be in on a week that they're normally not in, we've got about 20 spots that you can come into. Half of them have devices in them, and half of them have the docking station. So you bring your laptop with you and you can connect. So that's one way to help with that oddity when you've got people coming in that you're not expecting. But absolutely, I got lost. What was your original question?
How have your supervisors and managers adapted
Got it.
to managing this remote workforce?
Yeah, so it is different. And one of the things that you run into is kind of an isolation phase that you go through, and you're disconnected from your team. So we've set up regular times for all the supervisors and managers to meet with their teams individually, and then one-on-one sessions. Another thing that's kind of unique is kind of what I'd call like a water cooler time. So, you can set 15 minutes up that, hey, if you've got the time, jump on and let's just have a chat. What are your kids doing? How are you doing at home? Does anybody need anything? So it's kind of like a social moment that you miss by not being in the office.
Agreed.
Yeah, just to further add, we've gone through the process of making sure that the managers and the supervisors all have scheduled times early in the morning, as far as just have kickoff calls, just to make sure that everybody's on the call, so that they can at least hear each other's voices to try to stay connected. The one sort of nuanced thing, and I love what Rick is doing there, and probably take a few of those ideas and install here. But a few weeks ago was Patient Accounting Week. And so what we tried to create was, or what we did do is we actually had a drive-through where all of the managers, all of the supervisors had put together care baskets. We had a few vendors that actually donated some lunches and just different things. And so as the staff rolled through that drive-through, they stopped. The management team, said, it's wonderful to see you. Thank you for, sticking with us. Gave them their lunch, gave them their little care package, their little happy. It was one of those things where it was great for people to actually see each other, again, face to face. But then, obviously due to the drive-through, they drive off and then they're gone again. But at least that was at least a nice, good touch point where you truly saw each other face to face versus, this virtual world that we all live in now.
Yeah, I know. I mean, I think it can be very isolating for some folks. So being able to make sure they feel connected and supported. Now, I know Celeste and Chris, you guys are both Epic shops, and being able to manage productivity, I think, looks really different for you guys versus people who are not on Epic. Talk a little bit about how you guys can monitor productivity and make sure that, people are working when they say they're supposed to be working.
You want me to go, Chris?
Yep.
Okay. So we have an Epic time log. We have productivity reports that you're able to generate in Epic. We just created a quality scoring process for Epic where we can we will begin to start meeting with our staff on a monthly basis to go over their productivity. Prior to COVID, we were not doing that, at least at my shop specifically. We were still building out and making some changes around the work queues and activity codes and things like that. So you can definitely create what you want using the system, and that's what we had been in the process of doing. So I'm super excited about rolling that out to our staff, because when people ask the question about whether or not productivity has really gone up, I said, for me, the jury's still out for a couple of reasons. One, because our volume was down, basically because of our flood. So volume has been down because we were not up and running to our full size. And so that's reduced the volume, but also given us some time to do some additional kind of cleanup and get this work done. So that's kind of if there's a positive side of that, the positive side has been able to, and I'm sure everyone has been focused on cleaning up what's in your AR and trying to collect the money that's there that you may not have otherwise had time to focus on, and rolling this out to our team in a really nice way. So we're working on that, and Epic support, the system is great with that.
How about you, Chris, monitoring productivity remotely with Epic?
So the unique thing about Epic, and I'm sure if anyone on in the meeting is on, say, for example, Cerner, many of your big health information management systems have the ability to track productivity. The unique thing about Epic is it actually has timestamps of every action that they do throughout the day. So when they log in for the day, when they punch the clock and indicate that they've started working, we can actually go in and see every single action from the time that they started from the time they end, and we can see any idle time within Epic related to their activities, what they did, what they touched, everything. What we have done in my office for many years, but we utilize the Epic productivity numbers, the reports to measure efficiency. We've had a log for each employee, and the managers each week go in and look at what, how much actual work time they had logged into the time system. They enter that information in addition to the number of unique accounts that they have worked in Epic, and we have an efficiency rating for each employee that is shared with each of them each week. And if they're not meeting minimum being 100%, then we start looking at what type of improvement or opportunities we need to address within what they're doing. But we've, just like Celeste, we've had quality review programs where we review 5 accounts per representative. We identify those accounts through looking at those timestamps within Epic, looking at those productivity reports. We can actually see which accounts they touched, and we randomly select those for QA. So we do a multi-phase approach of as far as production by not only looking at what they're doing, tracking their efficiency and holding them accountable, but also QAing their work to make sure they're doing quality work and not just number of touches.
Yeah, I can almost envision them becoming air traffic controllers, if you would, that they've got all this data coming at them now and making sure when you're as large of an operation as you are in a centralized business office, is that you've got all these employees that you're just trying to make sure are actively working. I joke with people sometimes when I was never underestimate the creativity of people and wanting to monitor, are they working when they say they're supposed to be working, is I actually had an employee, if you're familiar with Atlanta, we were right on Pill Hill. She would come, log in, check, swipe in, then she'd get on MARTA and head down to Grady, and she would go work at Grady. And then she'd come back at the end of the day and she'd swipe out. Once we started implementing some robust productivity tracking, she was pushing back pretty hard. And that's how we discovered she was dually employed by both St. Joseph's and Grady. I was like, that was really creative. So, productivity monitoring to making sure that people are working when they're supposed to be working and doing it the way we want.
Well, I'm glad she was getting the work done here.
Yeah, you got the benefit of it. We were paying. You guys got to at least have her on staff. So that was the funny part. It's like, who would have thought? My brain does not work that way. That being said, with everybody sending people home and monitoring productivity has become, pretty much, I think it's always been important, but it's probably one of the more important things now is making sure our remote workforce is working. I would imagine everybody on this panel is looking for different ways to improve efficiencies in the revenue cycle. We've had bots around, some robotic process automation, and we're now starting to see machine learning and artificial intelligence integrate itself into the revenue cycle. Jason, I'll start with you. In the next 12 to 24 months, do you see that your organization will be looking at robotic process automation, machine learning, and AI, and integrating it into your operations?
So what we have done thus far, as far as in dabbling into RPA or bots, has been in conjunction with vendors, whether that be through revenue integrity or some other portion of Rev Cycle. We've partnered with vendors that we're actually utilizing the bots and helping us gain that efficiency in that manner. We have discussed multiple times as far as actually moving into actually building the bots or using someone else to help us build the bots ourselves, and then we provide that maintenance. We're having conversations about that, but we have not jumped into that yet. But like I said, we're having conversations and wanting to move that direction. Yes.
Rick, what about your team?
Yeah, well, we do some through a third-party software that it's really RPA, and you've automated some very manual processes, but they're the same thing over and over.
Mm-hmm.
So we've done a good bit of that, and that really has helped a lot. We would like to start looking at more of the true AI, where decisions can be made and route things to the right place when it needs to be touched. by a person and actually take actions when the system knows what to do as it learns the different processes. I think that's a big next step that we're all going to be dealing with, just to make us more efficient and more timely with whether it be follow-up or billing and things like that.
Chris, anything going on down in your neck of the woods related to AI and machine learning?
We've been engaging with business partners that are the best in breed in AI and are looking at utilizing that in the coming year. My main focus is trying to get that up and running and implemented for insurance follow-up. I think there's a great area of opportunity within follow-up to where I've seen other demos done where a bot can go out to an insurance company website and search for specific denials or things, give a status back quickly rather than waiting on a paper remittance or a 835. So if we can deliver that information back and trigger activities, work queue actions within Epic to drive accounts quicker to staff, I think that will be one of the things that I really want to try to get put in place, but also with the billing part, seeing how we can utilize bots in dealing with T-status, DDE related items. If you have a system where you don't have DDE direct, all that manual work that you have to do on T-status and DDE is time consuming. So we're looking at a variety of different areas, not only in my area, but also in patient access and denial mitigation.
Celeste, what about Grady? Any plans, or you guys are just more focused on getting your beds open and getting
No. We have some time ago, we have an awesome revenue strategy team that has been doing a ton of work with Sandra on, so they implemented a UiPath solution. So we've been using bots for a while for actually, I think I mentioned to you guys, we used it for HRSA because any of you who dealt with trying to get our patients into that database was a painful process. So we use it for that. We use it for some of our ED triage. We use the bots for our 277s to attach our retro Medicaid accounts. So we've been doing that for a while. And then as far as kind of machine learning, the only thing that we're doing is working with a vendor on a denial predictor solution, which is largely focused on the machine learning.
Okay, I'm going to go a little bit off script because sometimes things trigger my memories. I had individual prep calls and then group calls. So our company, has an AI joint venture with another company. And I always like to tell people, robotic, it was explained to me in the simplest way from a data scientist is that, think of robotic process automation as the arms and legs that can execute a task, but the machine learning and the AI is the neural network that actually can tell the robotic process automation what to do. So far where we've been as an industry has been the robotic process automation, which still requires humans to kind of tell what the machines what to do. We're starting to see the introduction of the true AI machine learning. And if anybody's watched The Social Dilemma, you'll see that there's just so much potential with AI and machine learning. But Jason, you mentioned during our one-on-one, a concern you had is that one of the benefits of meeting in person at these events was going around and seeing what new vendors are out there and what great things that they've developed. Are you concerned that in this remote world that these vendors who are now starting to dabble in our space, you may never know about them, they may never take off because they haven't had a partnership? I call it our little ecosystem is that we do, vendors and technology companies and providers, we all need each other. But you brought this up, so maybe talk a little bit about your concerns and we can challenge HFMA leadership on the phone today to try to help us.
Yeah, I mean, especially in the AI area, it's one of those things where I'm getting a ton of cold emails, cold calls, sales, reaching out saying that they're, assisting, a great deal of, other organizations, but I've never heard of them before. And my experience is going to other, on-site conferences. So there's a whole bunch of AI companies that has just sort of, in my mind, popped up over the last 12 to 18 months. I don't know if they're legit or not. The reality is that I'm sort of almost blowing them off to a degree. I hate to say that for any of the salespeople that are maybe on the call that's reaching out to me. But if I've not heard from them before, because I've not seen them in a solutions gallery before, I have a little bit of a, I guess a little bit of a shyness to engage with them. Yeah, I mean, it's one of those things where, as we were talking, I typically use the solutions galleries or the conferences and the dialogue between, us as colleagues, across the industry to garner what is everyone else is doing, what's the solutions, so in my opinion, to a degree, I've got somewhat of a void of almost 12 months because the last conference I attended was probably, fall of last year. I have 12 months of, I don't know what's out there to a degree. And so that then makes me fear that I am one step or maybe 3 steps behind from implementing the latest, that's going to help my organization be the best. And so I'm sharing that, I'm here in Florida. I've shared that with the Florida HFMA, obviously the Georgia and South Carolina folks that are on the call. But yeah, we've got to figure out as far as how do we, close that gap, because if we don't know that there's something there, other than just getting that cold call, and it's totally random whether we decide to check it or not, that's right now, that's the only way we're going to know.
Yeah, I mean, I thought it was a really valid point to have brought up, because I do think people are getting inundated with emails. I think you can't really decipher between what's legitimate, what's not legitimate. And, if you don't get to go to these things, does anybody else on the panel have similar concerns? Because I thought it was such a great point, that Jason brought up. And to me, the risk would be we're just relying on our core systems and we're going to slow down innovation because we don't know that the innovation exists.
Yeah, absolutely right. And Jason's right on key. A lot of times where you pick up those new technologies and you hear about something is in a big solution center. It's difficult when you get 15, 20 vendors that are pinging you for 20, 30 minutes. You can't see them all. So you can't really get a good idea of what they really have unless you spend time with them. So I definitely miss the solution centers where you can go watch and see demos and get an idea before you fully engage with somebody.
Yep, I think our challenge, if you guys agree, we can give Lawrence and the other leadership in HFMA regionally a task, is to try to, how do you create that opportunity for the providers to get a taste of what's going on in a virtual world. So
Valerie, let me just throw one little tidbit in for the sales folks that are on the call. It's one of those things where if you send an email that actually has a link to a website in it, please understand, as far as we're conditioned to delete that and call that phishing immediately. So I'm not going to look at it because that's the way I'm being trained by my IT staff. So don't put the links in it, please.
No, but I hear you. Actually, our organization sent out a link to get a free, like $10 for a lunch and learn. And I deleted that. And then somebody said, no, that was legitimate. That was a real $10 for pizza. So yeah, we've all been, delete. Chris, maybe talk a little bit to us about the patient at the end of the day, and how are their expectations changing of us in this virtual world? What's your, opinion on that?
Well, I think it definitely is taking the trend of what we're doing, much like what we're doing in the business office. I think we're going to see a pretty big shift towards engaging with patients online. Approximately, 15, 20% of our patients have a login with MyChart and engage and make payments. We'd love to get that up, 30, 40% or higher. But it's definitely where, the good thing with Epic and other systems like that, you have MyChart where they can do appointments, they can send emails to customer service, they can engage, they can pay their bills, set up payment plans, they can control. It's pretty much self-service unless they need you and reach out to you through that automated tool. So I think that's where it's really going to shift. A lot more folks are going to take advantage of what we've seen in COVID to shift more electronic. You're still going to have a particular population of patients that still want to sit down and talk to someone, but I think as time goes, you'll see a lot more patients shifting to digital, wanting to pay, control their payment plans, maybe getting their statements electronically like Epic has available to them, but engaging with the health system electronically and demanding that they get maybe even get incentives. Maybe if they're engaging you in that way and saving you money, saving you cost on statements, maybe you offer them some discounts by them doing that. So I think that's where it's headed.
Now, I moderated a session, several months ago about like a virtual patient access experience. And the feedback from the people on that panel is that patients are getting used to this virtual check-in, and even in an emergency room setting, they really don't want to sit down face-to-face anymore. They want to be able to use their apps. Again, I'm off script a little bit, but the folks on the panel, is that a similar feel that you're getting from your patients? And are you going to see your organization maybe invest in these, touchless experiences for the patient?
Yes, absolutely. We're seeing that definitely on our physician side of the world. They're already there. You check in on your device, you can complete everything, you can make your payment. It all happens, but it's also, it's a real individual decision. So I think Chris is right. You're still going to have people that want to come in, sit down with that same representative they always have met with that works out the payment plan for them. But we've got to be able to provide the means to the public on an individual basis. However they want to communicate with us, we need to be available in that manner for them.
Chris?
I couldn't agree more. I mean, like we opened up as far as initially, that's our main sort of focus right now is patient engagement on the front end, whether that be scheduling or registration. So I reiterate everything that's been said.
Yep.
Yeah.
So I was going to say, go ahead, Celeste.
No, I was going to say I also agree, and we're focused on rolling out telemedicine to our other locations, to like our skilled nursing facility. But I will say one of the things that I have noticed that we have to do a better job of is setting the financial expectations for the patients, because for some reason we're finding that if patients are having virtual visits, there isn't an expectation that they would have, co-payments, right? And so we have patients call all the time and say, well, I wasn't physically there. Yes, I met with the provider, but I don't understand why I'm getting billed. So I do think it's more of a psychological thing, right? And so we do have to help ourselves, our patients, our families understand what to expect when they're having a virtual visit, video visit, telephone visit, whatever mode that visit is, and what that financial implication is, because I don't think that they always think of that.
I think that's a really interesting point, is that it's that psychological factors that I didn't physically go anywhere, so therefore, I don't have to pay for it. I think this is a good transition into, one of the last topics. We've got less than 10 minutes left, but price transparency. So, and to me, I always say one of the things that I like about the revenue cycle, well, there's a couple things. I always say it's the puzzle you'll never solve, because the rules are always changing. But we also are the patient's experience, and we get to sit there and empathize with them. And sometimes people don't really appreciate the patient's viewpoint and how hard it is for them at times. And there's a study out there that once an out-of-pocket reaches around $200 for the average American, that becomes a financial burden, and they're having to make decisions between paying their electric bill and paying their medical bill. I think it's a great point about setting expectations. Price transparency, we've had rules thrown at us that maybe we do or don't agree with. At the end of the day, I think it's about the patient and being an advocate for the patient too, to helping them understand their contract with their managed care provider, how much they're financially obligated, and then helping them to figure out how to pay it. With price transparency, we've got the 2020 outpatient prospective payment rule, Trump's executive order. Then we had a few things thrown at us with the 2021 inpatient prospective payment rule. So are you guys on track to be compliant as of January 1st? And Has anything with the recent inpatient prospective payment rule changed your outlook on this? So Celeste, since you kicked it off, maybe you can start with what's Grady doing around price transparency and what are your concerns?
Yeah, so we're absolutely on track. I think this is another, and maybe Chris will probably jump in on this, is that we, because we're using Epic, we've largely, I feel like, been ahead of the game in terms of being prepared for price transparency. For us, also working through the physician component of Emory, Morehouse, and Grady, and coming up with a strategy for sharing those prices for, those shoppable services. And I know that, recently we just had a conversation about the payers having the requirements.
Mm-hmm.
And so I think that's interesting. And I think we want to see what that looks like and how consumers really use that information. So I think we're in a good place.
Yeah. Chris, what about you guys?
Yeah, we're definitely on target to meet the deadline, if not before. Baptist has had a patient cost estimator on the website for Baptist Memorial for probably 11, 12 years. So we've enhanced it since then. Back when the last price transparency update happened, we simply updated that site. And of course, that's what a team is doing right now as a result of the latest update. So I have no concerns about us being compliant. I think the big thing, and I think all of us would agree, is there's been a lot of misinformation out there in the news that is confusing patients. And if the average person doesn't understand how hospitals are reimbursed. You can't compare a hospital charge or a bill to getting your car fixed. I mean, it's not the same, obviously, and so I think there's a lot of misinformation out there, and it's not the patient's fault. It's not necessarily our fault, but it is our responsibility as health systems to make it user friendly. Go through the misinformation that's out there in the news and try to explain to them in a simple way through online tools. But put yourself in the patient's shoes and make it to where it's simple to understand. They may still have questions as to why you're charging $4,000 for a scan that took 10 minutes or whatever, but they don't understand how insurance companies reimburse us for through package pricing and so forth. So I think that and the requirements on insurance companies to be transparent. I think you're going to see as a result of this a pretty big shift, and if it goes through to where both sides have to share costs, that I think that it's going to hurt insurance companies more than it's going to hurt us, quite frankly, in my opinion.
Rick, what about Floyd?
Yep. So we're not an Epic shop today, so a little bit different. So we have a third party that we've been working with, and we're actually right now validating data. So we will be ready before the end of November. We won't put it out there until we have to.
Yeah.
But no, we should be ready. And I think what has been said so far is really true. We've really got to help educate the patient what all this means, because knowing what the allowable is,
I know
they don't care about that. They really want to know what do they owe, and so I think education of our patients is going to become more crucial when this goes live.
Yeah, I agree. And Jason, what about you guys?
Yeah, I couldn't agree more. As far as the biggest thing, with the regulations and the legislation that we're having to address, in our opinion here, was making sure that we had a really easy to use estimation tool. We rolled that out around May, June of this year, have continued to look at potentially even adding more services to that. We have well above the 300 that is required, but trying to add more, especially for those patients that are interested in specifically prices. And that estimation tool doesn't just tell you what the allowable is, but it actually, if you put your insurance in, it'll ping the insurance and tell you, where you are as far as in meeting your deductible and what your true copay or co-insurance amount would be at that time. And so that was the most important to us. We are working with a vendor to come up with that machine readable to meet the other piece of that. Here in Florida, because it's a unique dynamic here, I think we're all going to sort of have it in our back pocket and wait to see who plays chicken first or who loses. I don't know which way you glass half empty or glass full. Yeah. But that's going to be in our back pocket. We'll have that, and we'll be able to pull that out there when and show it if we need to or when we need to. So
okay. So we have about 4 minutes left, and I thought maybe we would end. We'll start with you, Celeste. But what are your words of wisdom to folks, given everything that we started off at the top of the hour that we're facing? Like, what's your best advice that you can give to the people listening today?
I think the comments that people made about how do you keep your employees engaged and feel connected. I really am very proud of our organization around that. And Sandra has town hall meetings. So I encourage you to stay connected with your teams. And part of that being connected is sharing their productivity, getting them involved in that information, and ensuring that people do feel that their safety is first, and that we can do all of it. We can be safe, we can get the work done, and we can care for our patients and our community.
Chris, what's your words of wisdom as we wind down the hour?
I will echo what Celeste said. I think the main thing is as we go in, come out of COVID and go into a hybrid model or even a full-blown remote, is remaining engaged with your employees, making sure that they're motivated through positive reinforcement. Something to consider would be if you are going to go hybrid or remote, and you're saving cost on overhead, think about utilizing some of that saved money and using reinforcement, through, high performers, getting, a lot of folks like money. I think most of us do, so using that. But the other word of wisdom probably would be do all those things, keep your folks engaged and happy, because if you don't, I'm coming to recruit from your area.
Okay, Rick, now what are you going to say back to that?
That's a two-way street. We can recruit in your area. I think, we have seen that a remote workforce really works in our avenue. A few places have had it for a long time, but boy, COVID made us really all jump on board. So I think, stick with it and keep making the improvements to keep your staff very efficient. And the other thing is, I'm still on my denials kick. Fight every denial you get. It is worth it. It pays off.
All right, Jason, words of wisdom.
The one thing as far as through COVID is that we have really focused a lot on physicians and nurses that are the true leaders. And I will not deny they have been at the tip of the spear in the patient's room and doing a lot of good work. It's one of those things but we're all healthcare workers. And it's one of those things where my registration staff are working shoulder to shoulder in that ED, working with everyone, my case managers, my social workers, my utilization review folks. They're all on the units just the same, as well as my business office and coding staff that are at home that are almost feeling like seclusion. It's one of those things where it's a huge dynamic, but we are all healthcare workers. And for us to all remember that we all have lived through this together, and that we all are trying to figure out how do we come out of this as sane as possible, but that we're still continuing the fight, the good fight against the insurance companies, but also for our communities and the patients that we serve.
Yeah, and before I turn it back over to Bill and the folks at HFMA, my parting words would be, with the currents as rough as they are right now, just letting your revenue cycle drift would not be a wise decision, because you may end up in Hawaii, but you also may end up in a not so nice location. So now would be the time to really be looking at a strategic, a strategy articulation map and thinking about where it is you want to go and trying to figure out what you can control and moving that. I want to thank you guys. It's been a pleasure talking to you and getting to know you guys. And Bill, I'm going to, give it back over to you for a wrap up.
Valerie, thanks so much. And thanks to all of the panelists. That was super. A lot of really good feedback and a lot of input. You know, I'll kind of echo some of what Jason said, is that we've heard a lot about the first responders and the frontline workers, often from more of a clinical perspective, and certainly not to downplay the work that they've done at all, but we've got a lot of really dedicated and hardworking people on the financial side of healthcare too, who are on the front lines of helping the patients with their experience through all of this. You know, dealing with the insurance and the financial responsibility of everything. So really couldn't do it without you. So thanks to all the healthcare financial professionals out there as well. So thank you for everybody's participation. We have come up on our time here. This session has been recorded and will be put out on the chapter website in the In Case You Missed It section here, probably over the course of the next couple days. I'd like to remind you of a couple things. We've got a gathering up at the roof on top of Ponce City Market later on this evening. There is limited capacity up there, unfortunately, but if you are planning on going up there, we look forward to seeing you. And also Mark Richt, former coach of the Georgia Bulldogs, will be joining us at 3 o'clock for a session. So I want to invite all of you to come back and join us for that. So let's keep the dialogue going on a lot of these topics. And as we all said, we're all in it together. So best of luck to everybody. And thank you again to all the volunteers and everybody who's helped put this meeting on together this week. It's been great so far. And we appreciate your support of Georgia HFMA.
Thanks, Bill.
Thank you.
Thank you.
Thanks, guys.
Thanks so much.